Hello, and welcome to this training session for the SmartEP Frequency Following Response options by Intelligent Hearing Systems. Frequency following responses are acquired using the Advanced Auditory Research Module and its submodule, the cABR Research Module. Research supporting this cABR technology was developed by Dr. Nina Kraus and colleagues at the Auditory Neuroscience Lab at Northwestern University. The stimuli, settings, and MATLAB toolbox have all been provided by the Auditory Neuroscience Laboratory. What is a frequency following response? It is an electrophysiological auditory potential and an individual's unique neural signature evoked using complex stimuli such as syllables, musical notes, words, sentences, ambient sounds, and more, and it is acquired using synchronous time averaging by non-invasive means with a device such as the Evoked Potential SmartEP Duet system. FFRs reliably measure fidelity and precision of sound encoding. Why are FFRs valuable? In addition to the advantages that the FFR gives us to study the function of the auditory pathway, there are other reasons to expand brainstem auditory evoked potential studies to include complex stimuli. The FFR's output are very similar to the stimuli input that triggers and evokes the response, making more transparent the stimulus-to-response relationship. FFRs provide information about the auditory efferent system. FFR reflects a person experience in sound. Reliable and objective data can be easily obtained. Before we dive into the details, let's discuss and clarify some terminology. The Auditory Neuroscience Laboratory at Northwestern University early on referred to the FFR as ABRs evoked by complex stimuli in order to encompass not only the sustained steady state response, but also the transient portion of the frequency following response. In various studies, scientists and researchers have called these responses by many different names, including cABR, envelope following response or EFR, auditory neurophonic responses, auditory steady-state responses, or ASSRs, all encompassing the transient and fine structures of these responses. With time, the Auditory Neuroscience Laboratory, as well as the cohort of researchers in the field, have moved to categorize these responses under the umbrella of frequency following responses, or FFRs. Thus, throughout this presentation, you will find that we use the term cABR synonymously to FFR. To acquire the FFR with a Duet device, you will need skin prep pads to prep the electrode sites, the 5 electrode lead patient cable, reusable Gold Cup electrodes or Ambu disposable cup electrodes, and 10-20 paste to fill the cup electrodes and surgical tape to affix the electrodes. The setup is typically a 2-channel setup for right and left hemisphere data acquisition. The images on this slide show the connections for the Universal SmartBox platform, as well as the connections for the Duet 5 electrode lead patient cable. The test ear earlobes are always connected to the negative input for each channel, where channel A is the right channel and channel B is the left channel. CZ is the positive electrode, connected via Y adapter to both positive inputs on each channel. If CZ is not available, then positive can be placed on the high forehead, but we highly recommend a CZ placement. Low forehead is connected to ground. The stimulator most widely used for the FFR test are the ultra-shielded insert earphones because they reduce stimulus artifact. IHS offers 2 versions, the ER3A ultra-shielded and the ER2 ultra-shielded insert earphones. If purchasing the latter ER2s for the Universal SmartBox platform, a booster cable is required. When testing persons with hearing aids or cochlear implants, sound field speakers can be used to deliver the stimulus. IHS offers the following components for sound field option. The Duet or Universal SmartBox sound field output cable to amplifier connection is used to connect the Duet or Universal SmartBox to the sound field audio amplifier. The speaker cable connects the sound field audio amplifier to the JBL speakers. Note that calibration of the stimulus file is affected by the distance of the patient to the speakers. The sound output level will affect the latencies of your responses. For additional information on sound field setup and calibration, please contact our support team. Testing environment should be shielded and must be properly grounded. A soundproof booth or room is recommended. Please refer to IHS's technique for acquiring good quality auditory evoked potentials video for additional guidance. Patients should be tested seated or lying down on non-conductive surfaces or recliners. Patient state is important and should be as controlled as possible. FFR testing can be performed in sleep or awake patients. For awake patients, it is recommended that a silent movie be played on a tablet-like device and that the patients be asked to refrain from any head or body movements during the test and focus solely on the movie that's being played. Tablets should not touch any electrode leads during testing. If the tablet does not have a 3-prong grounded power supply, then it should be fully charged and run off of battery in order not to introduce any electromagnetic interference. Now you are ready to begin testing. Enter the person's information into the IHS testing database, then follow the simple 3-step acquisition process. Load settings, select the test year, and click Acquire to begin collecting data. You should always begin with a standard click ABR at 80 dB NHL to verify neural synchrony and identify peak 5. After acquiring the FFRs, you should also repeat or end with another click ABR to validate that the transducer placement inside the ear did not shift during testing, and that the click response is the same as the initial click ABR that was done at the beginning of the test battery. When the cABR modality is purchased, you will have access to 4 cABR settings files, 3 170 millisecond speech stimuli, ba, da, and ga, and a shorter 40 millisecond da. Other settings files, including the Advanced Auditory Research Module ADV setup files and test protocols, can be created, saved, and loaded by the end user with preferred stimulus and acquisition parameters. When you load the settings files, your acquisition page control panel will change to link the Advanced Auditory Research Module. You can access the module from the Setup Advanced button on the top left of the control panel. At the center bottom of the control panel, you can see the name of the advanced setup file that was loaded along with the settings. Just above it, you can set the number of sweeps you wish to acquire. Sweeps are typically set between 1024 and 2048, and the best responses will be obtained when you have averaged at least 2 to 4 recordings together. You can also access the stimulus generation window to select your output stimulator and set the stimulus output mode. Remember to always use SPO output mode for complex speech stimuli. Some researchers want to analyze single sweep information. In this case, one can activate the block averaging option and set it to 2 sweep blocks. Then use the split block option to split the block to single sweep. To obtain FSP and FMP measures, also activate block averaging and make sure to specify an FSP point. The general parameters that load with the cABR settings in addition to the stimuli are the intensity, 80 dB SPL. It is worth emphasizing that if you're creating your own settings file, ensure that the output mode in the stimulus dialog window is set to SPL for all complex speech stimuli. The rate, 10.9 per second for the short duration 40 millisecond DAW, and 4.35 per second for the long duration 170 millisecond stimuli. Stimulus polarity is alternating. Note that the SmartEP software provides the ability to split the recording into rarefaction and condensation results. On the main acquisition page, you can access the amplifier window from the Amplifier button to view and set the amplifier settings. The default cABR settings files are set with a gain of 100K, a high pass of 30 Hz, low pass of 3000 Hz, notch filter is on. The channel designation is as follows for a 2-channel system. Channel A is set to right and channel B is set to left. Artifact rejection is set to approximately 31% and may be changed as needed. Here's a summary of how to initiate a test. Enter the first and last name of the patient into the iTest database and click OK to register the patient. Next, check impedance. Make sure impedances are less than 5 kiloohms and balanced across electrodes. The lower your impedance, the better the data quality. Then, select Load Settings on the control panel and choose the set of acquisition parameters you wish to acquire. Your settings will load on the control panel as well as in the amplifier window. View your EEG for both channels. Select Acquire to begin testing. I have selected to acquire a cABR. For more information on ABR testing, please refer to the adult ABR and pediatric ABR videos available on our YouTube channel. I can label recordings as they are being acquired. When I've completed the cABR test, simply move the data to the click page. Pages can be set up under the Set Page menu. Return to the acquisition page and select Load Settings again to load the 40 millisecond DAW settings file. And then click Acquire to begin acquisition. A 40 millisecond DAW is acquired to obtain timing information. Let's take a look at the typical characteristics of the auditory evoked potential to a 40 millisecond DAW complex stimuli, as described by Sko and Krauss. The stimulus is delivered at time 0, but there is a neural lag or delay before the response occurs. The stimulus shown on the top panel is thus shifted in this image to compensate for the delay shift and to demonstrate how the stimulus lines up with the response. Now analyzing the response, the front end portion of the response, which is a direct result of the onset of the stimulus, specifically the consonant simulation, which produces a transient response with a peak 5 of the ABR, is followed by a trough A, or the SN10 response. Then, you have the sustained portion of the aperiodical stimulus envelope with troughs C, D, E, and F. And finally, the offset of the stimulus, trough O. The timing latencies are typically marked for evaluation. The vowel portion of the stimuli, especially in the longer duration speech syllables, will produce a steady-state response that follows the transient and sustained responses. Here's a sample 40 millisecond DAW acquired at 80 dB SPL. 3 runs of 2048 sweeps were acquired. After you've acquired your 40 millisecond DAW, then you would acquire the longer duration BA and GA complex stimuli. These are acquired by loading the respective settings file. GA and BA are typically acquired at 80 dB SPL with 2000 sweeps. 2 to 4 recordings can be acquired. Note these are longer stimuli and require a slower rate of stimulation of 4.35 per second. Thus the time of acquisition is longer. If you're short on time, then 2 versus 4 recordings would probably suffice for the grand average. Thank you for watching this video. There are 4 parts to this video series. If you wish to learn more, Part 2 covers complex stimuli and stimulus options. Part 3 reviews the Advanced Auditory Research module, and Part 4 reviews FFR data analysis. For more information on the SmartEP FFR options, please contact our sales team at sales@ihsys.com or visit our website at www.ihsys.com. If you have any technical questions or suggestions, please contact our support team at support@ihsys.com.